Minister, page 58 of your programme for government actually says we will reduce emergency department overcrowding. That's an awful joke in my city, turning into an absolute nightmare. Yesterday, 81 people were lying in trolleys in University Hospital. Today, there's 80 people packed into the emergency department like sardines. The INMO have described it like a small hospital being piled into the UHL. The Minister for Health recently made a secret dash in and out of the hospital last month. He avoided hard questions from public reps and the media, but nothing has happened since his visit. Things have in fact got much worse. Your government's action to date have been disgracefully inadequate. And when will this overcrowding situation going to be properly addressed?
Deputies, as I'm sure the Taoiseach and the Minister for Health have contended, since 2017 a further 267 beds have now been opened up in our hospitals to respond back to the very kind of issues that patients, nurses and doctors are dealing with at the moment. In the HSE capital plan that was published a number of weeks ago by myself, the Minister for Health, and by the Taoiseach, it outlined the plans that are now funded to increase the number of beds in our health service up to just above 11,000. So it's good to hear that at least one of the projects that the Deputy referred to is included in that capital plan. We have bud funding in place to increase the number of hospital beds. We have made changes recently in relation to how we pay our nurses to ensure that we can have the staff in place to ensure that more beds delivers better care for patients. But the points that the deputies have made about the need for this work to be commenced quickly and to have it done quickly, I take on board, and I'm sure the HSE and the Department of Health will ensure that the additional funding that I've made available to them is quickly spent.